and answer your questions. First, let's invite the Vice President, Mr. Han Ding, to talk about the medical team dispatched by the Peking Union Hospital. On the first day of the new year, the Union Hospital received a notification. The NHC has sent out a notification to form a national medical team to support the Hubei province. Each one of the hospitals will receive 20 medical staff, so including the Union Hospital and the China-Japan Friendship Hospital and the other 4 hospitals. So for each one of the hospital, we will send 20 people to form this national medical team. For the Union Hospital, they will also send a vice president to be the leader of the medical team. So in the evening of the second day of the new year, we have arrived in Wuhan. So we are working together with one of the Wuhan hospital to receive the critical cases. On February the 6th, we received another notification. So the Peking Union Medical College Hospital will also take charge for the CCM of the Wuhan hospital. And Mr. Zhang Shuyang lead the group, accounting for around 142 medical staff to depart for Wuhan, because we need all-rounded support for the CCM and the respiratory department. In addition to respiratory department, CCM department, and also nurse experts, these people will form a national medical team and they depart to Wuhan for support. And especially they're focusing on the treatment of the critical patients. So for the first batch of the team, already departed to Wuhan on December the 31st. As of now, we have 164 medical workers that are working on the front line in Wuhan. Next, let's invite Mr. Zhou Jun to talk about the situation of China-Japan Friendship Hospital. For China-Japan Friendship Hospital also belongs to the National Health Commission. On December the 31st, 2019, according to the guidance and instruction from the NHC, Cao Jun led the medical team from the China-Japan Friendship Hospital and depart to Wuhan. As of now, we have already dispatched 5 groups of medical staff. As of now, we have 153 people working in Wuhan. Basically, this team can be divided into 2 parts. For the first group, we are supporting the Tongji Hospital, and the major task is to conduct treatment for critical patients. We have over 100 medical staff that are based in those areas, and for some of the experts, they have rich experience, especially in the area of respiratory tract infection and CCN. And for the second group of the medical team, so for the China-Japan Friendship Hospital, we are taking emergent tasks from the nation. So we are serving some of the patients that are in the makeshift hospital, what we call the Fangtang Hospital. So we are working together with the Wuhan medical staff. We have formed a 1,500 people medical team. As you may realize that Mr. Cao Bin, the vice president of the China-Japan Friendship Hospital, they are also doing some field research on the medicine, the medicine. Thank you. Now let's invite Vice President Mr. Ma Xin to update the situation of the Huashan Hospital of Fudan University. For Huashan Hospital, we have dispatched 4 medical teams. For the first team, it was dispatched on the New Year's Eve. On the 4th day of the new year, I sent the second group to Hongqiao International Airport. Last Tuesday, I led another team with 46 medical workers and take the high-speed train to arrive in Wuhan. And also, we sent 6 mobile hospitals to Wuhan. We arrived in Hongshan Stadium, and also we take duties in the makeshift hospital. The day before yesterday, 165 medical workers once again take the plane to come to Wuhan. So this team will also work in the CCM area for the Tongji Hospital. We have 30 doctors and 180 nurses. So these people will take care of the patients in critical conditions so as to reduce the death rate. This is the general situation of Huashan Hospital of Fudan University. I am the leader of the medical team to mobilize the resources and medical workers. Among the 4 teams, most of the medical staffs are coming from respiratory department and ICUs and clinical lab. So we are working closely to form an MDT team. So we just try to improve the cure rate of the patient. Thank you. Now the floor is open for questions. Please identify where you're from before you raise the question. From Renmin Daily. For the 3 leaders, they have just talked about the medical teams. As we have known that many hospitals, they are actually bringing medical equipment to the hospitals in Hubei province. So can you tell us what measures that you were taken to deal with the critical patients? Maybe we could start from Vice President Mr. Han Ding. This is a very good question. Each hospital has its own advantage. For Tongji Hospital, we are actually a system dent in the CCM and the respiratory ICU department. So the hospital have made a lot of preparation in receiving us. We are sending relevant experts to support the work of Tongji Hospital. And for the experts and the nurses that we are sending to the Hubei province, they have some experiences in fighting against SARS and relevant infectious disease. At the same time, we are also bringing in experts from different departments. As I have just said, in addition to the experts from CCM, we also have some experts that are coming from cardio department and the nervous department. Because for patients with critical conditions, they may have some chronic disease, and some of the organs may deteriorate during the procedure process. And they may also have some complications because of the outbreak of the coronavirus. So we just want to make sure that we give full play to the advantages to the experts so that we can provide better treatment to the patient. So for each one of the 32 patients, some of them, they have to use the respiratory machine and a lot of equipment to help them to survive. So under such a emergency situations, we have to use special methods in order to rescue the patient. So the ultimate goal is to reduce the death rate and to increase the cure rate. Thank you. Mr. Zhou Jun. Thank you. As I have just said, for the China-Japan Friendship Hospital, it belongs to the National Health Commission. And also it is a research center for the respiratory field in China. So we are quite experienced in the area of the respiratory infection. At the same time, we are also preparing to build a respiratory center in the China-Japan Friendship Hospital. That is to say, we acquire advantages in the area of respiratory disease. So for our hospital, first of all, we will put a lot of emphasis on the prevention. And also we take different kinds of treatments to deal with patients with different symptoms. So each one of the departments will play their role in cure those diseases. So for some viral pneumonia and some infectious disease, all of these are within our scope of treatment. So that is to say, all kinds of lung disease and pneumonia can be treated and being studied in the China-Japan Friendship Hospital. For the director of the respiratory department, it's actually led by an academician, Mr. Wang Chen, and the vice president is Mr. Cao Bing. And he himself is also leading the area of the research and development in the area of respiratory disease. And this time we came to Wuhan, and we just want to give full play of the advantages of the China-Japan Friendship Hospital in dealing with the infectious disease, especially for the respiratory disease. So I have just said, Mr. Wang Chen, the academician Mr. Wang Chen, will be the leader of our medical team. And for the vice president, Mr. Cao Bing, so he's actually the group leader. We also have two senior directors from CCM joining us in the medical team. And for the nurses, we are dispatched to Hubei province. These people are also working in the respiratory department and CCM in China-Japan Friendship Hospital. That is to say, we have a very strong team. And we just want to give full play of the team. In less than 10 days, we have transported medical equipment to cure the patients worth of around like 15 million RMB. So some of those equipment are quite expensive and also quite useful to cure the patients in Wuhan. So I believe our team can play a key role to reduce the death rate. Thank you. Mr. Ma Xin. So for this time, for our hospital, we have bring all the talents and the backbones of our hospital, and also we bring some medical equipments. We have experts from the Department of the Infectious Disease, and for example, Professor Zhang Wenhong, he's actually leading the team, and also I invite several other well-known directors from the Department of the Infectious Disease. Because for our department, it ranked #1 nationwide for 9 consecutive years. They have rich experience in dealing with the infectious disease, and they have played a key role in curb the spread and contain the
就
virus.
像这次我们的移动医院驻地在红山体育馆，这是一个方舱
For
医院，
example, this
有
time
800张床位。我们一瞬间，我们收
we
治
have
了
800
500-600个
beds
病
in
人，
the
在
Fangcang
这里面对
Hospital,
我们来说
the
是一个巨
makeshift
大的挑战。
hospital.
因为这个体育馆它不是医疗机构，
Just
它本来就
within
是体育馆。
days, we receive
在这里面的
over
院馆的流程显得尤其的重要，
600
因
patients.
为它的建筑的格局，
For the
还有它
stadium
的这
itself,
个
it is not
电
a
线、
hospital.
水、
It is
厕
very
所，
important
它不
for
是按照
us
医院来设计的。
to make
这时候
sure
院馆
that
的
the
专家在这
layout
里
is
面就发
reasonable.
挥了重要的作用。
For example, the
还有排林布阵，
toilets and some of
要
the
把这个清洁
space
区
are not
污染区、半污染区
allocated and
要进行
designed
合理的划分。
in
首先呢，
accordance
减
of
少
the standards of the
我们医
hospitals.
务人员的这个感染率，我们争取做到零感染。 另外，通过
And
合
when
理
we
的
are
划
doing
分，
our work,
让我们
we
病
have
人
to
之
make
间
sure that
能够做到很好
we
的
can
合理。
protect our
我
doctors.
们的方舱医院在
And
昨
at the
天，
same
我们出院
time,
了
we should
28 个
have a
病
very
人，就
good
是红山
place
体
to
育馆，这
quarantine
也是我们非
our
常成功的
patients.
一个治疗的一个经
And
验。
yesterday,
我
we
们
are
等于把这个
delighted
流
to
程
see
走完了。
28 patients
在这过
already
程当中，我们华
discharged
山医院的
from the
管控
makeshift
团队，我们
hospital.
张金明教授发挥了非常突出的贡献。
So during this
前天我们
process,
210
the
人队
Professor
伍
Zhang Jinming
在同
has
济医
played a
院
very
光谷院
important
区，
role.
我们接手了这个重症的监护室，也是我们陈
And
树教授，
also
他
over
也是我
100
们感
people
染
from
科
our
的
medical
副主任，
team
他也在这里面
stationed
发挥
in
了
the
重要
Guanggu
的一个支撑作
Hospital.
用，
He
为
is
我们大
also
家提供
a
非常安全的一个流程。
key figure
首先，他
in
来
the
到一
area
个
of
新的一个
infectious
环境，
disease.
因为这个病房以前是个康复科病房，它不是专门为这个重症监护室
The
所
Guanggu
设置。
Hospital is
但是我们的
actually
陈树教授，他
rebuilt
呢立刻投
for
入
the
工作，然
CCM.
后呢把这个
It
康
used
复
to
科
be
的
a
病
regular
房
hospital.
划分成非常
After
精
Mr.
细的
Chen
污
arrived,
染区、半污染区和清洁
he
区，
made some
为我们的
reshuffle
医护团
and
队提供
changes
非
of
常好
the
的
wards
一个工作环境，
so that it
同
can
时呢，让
provide
我
a
们的
very
重症
safe
病人在这
environment
里
for the
面
medics.
能够得到一个非
At
常
the
安
same
全的治疗。
time,
除了人员之
we
外，
can also offer a
我
very
们在
safe
这个高
environment
精尖
for
设
the
备上
patients
面，
with
我
critical
们也是
condition.
带足了我们华山医院的家底。
Apart
大
from
家都知道，
the
我
medical
们做
equipment,
这个疫情的防控，还有这个
we
重度肺
also
炎的
have
治疗
a
过程当中，需要这
first
个 ECMO，
level
需要
equipment.
无创呼吸机，需要有创呼吸机，需要
As
许
we
多的
talk,
仪器和设备。
we talk a
那这
lot,
次
we
我们都
need
带了，我相信这些
respiratory
高精尖技术、
equipments and
高精尖
ECMO
的设
and
备，
a
在
lot
我
of
们在
cutting
重
edge
症患者治疗
technologies
当
to
中
help to
会
cure
发
the
挥出来
patients.
非常重要的一个作用。
I believe all of
谢谢
these
主持人。
technology will play a key role
接着提
in
问。
treating all of the patients.
新华社
Thank
记
you.
者提问：新冠肺炎的医疗救
新华
治
News
采取
Agency.
4集中的原则，请问这4集中具体指的是什么？另外，这么做
So you
是
always
希望
talk
达到
about the
什么样的
four
效果？
concentration. This is a principle to treat the patients. Can you tell us more about the four concentration? What does that mean? And what measures will you take to ensure that we can implement
我
these
想
four
大家都知
concentration?
道了，这个是在今年的大年初一的时候啊，这个是中央政治局开会啊，我们
So on the first day of the new year,
疫情和重症
I believe all of you are
病人
aware
就
that
提出了
the General
要
Secretary
按照
of
集中患
China
者、集中专家、
during the
集
Standing
中资
Committee
源
of Political
集中
Bureau
救治
of the
这样的一个
CPC Central Committee, he
我觉得呢
points
这
out
是
the
对一个
principle of
重
four
症患者的救
concentration.
治来
That
讲
is to
它是
concentrate
一
the
个非常
patients,
具有
the
非常重
experts,
要的意
the
义。
medical resources,
我觉
and
得
the
简而
treatment.
言
I
之呢，
think
我觉得
this
就
is
是要
very
集中优势
important
兵力
for us,
来把
especially
我
for
们
us
重
to
症的
treat
病人
the
能够
critical
得到及时有效的治
patients. That is to say,
具
we
体来
have
讲
to
呢，我觉得呢，这个
leverage
应该
all the
主要呢
resources
是分这么两层的意思。
so that we can better
来理
treat the
一个
patients.
方面，我觉得就是把病人呀要给集中起来，尤其是
Based
针
on
对
my
重症病人
understanding, first of all,
要
we
集中
have
起来干
to
嘛？集中起来要
concentrate all the
集中
patients,
治疗
especially for
所以
those
集中了要
patients
集中
in
要
critical
集中患者
condition. Why we
要集中
concentrate these
救
patients?
治
Because we want
那
to
谁给来救治？
treat these
要利用
patients
我们的优势
collectively.
资源啊，在哪儿来救治？
And then
要
we
利
have
用
to
我
make
们
good
的
use of
能力
our medical
实力比较
resources
强的这样的一些
to
的医疗
treat
机构
these
来
patients.
开展救治啊。应该
And
说
we
呢，
need-
是武
we
汉
need
的
to
这
have
次
very
疫情
strong
啊，应该是波及的
capability
面
to treat
还是
patients.
还是很广。应该说，从目前的这样的一种啊，我们的医疗资源的能力啊，尽管武汉
So as of
应该
now,
说
if we
是在
look
武汉
at
在
our
应该是
capacity
在
of
医疗
the
资源上
medical
医疗技术和
resources,
力量上
I would
都是
say
非
it
常雄厚
for
的。
Wuhan,
但是呢，面对这样为
it
数
have
的数
very
量的病
strong
人来讲，
medical
的的
resources.
确确
However,
还是
it received a great number of patients, so that we are still running short of medical resources, especially when they're dealing with the infectious disease. So that's why we have to concentrate all the major forces across the nation. We have to concentrate our experts and medical resources. And some hospitals, they even bring some cutting-edge technologies and equipment to help to treat the patients. So these people, these medical staff, they're bringing all of those equipments in order to treat those patients, especially those in the critical condition. So the final goal is to increase the cure rate and to reduce the death rate. So I think the principle of forward concentration is very important to contain the outbreak. Any more comments?
那么接着提问。
您好，中央广播电视总台央视记者王伟超。然后根据咱们刚才的介绍啊，那个同济医院中法新城院区啊是那个危重病集中的收治医院。
As you have said, that for the Tongji Hospital is set up a CCM to receive the patients of critical condition.
开展工作的，谢谢。
Can you tell us some what are the measures that's been taken by the hospital to treat those critical patients?
我们这个同济医院的这个中法新城院区的话呢，一共是
For Tongji Hospital,
18家这个国家和省市的医疗队在里边，每家医疗队呢。
There were 18 medical teams that are stationed in the Tongji Hospital, and each one of the team have around 150 people. So we need to form a very good synergy and coordination in order to conduct the work. And Mr. Ma Xiaowei is leading the medical team and make thorough arrangements. For each one of the team, they're responsible for one section. So in one affected section, it comprises around like 50 beds. For example, the Union Hospital, they will be responsible for some patients with critical condition. And for each one of the team, they will also have to form a very good synergy. For example, the experts need to understand the diseases and the issues from different disciplines. And also, we will conduct some remote diagnosis at the same time. So between the different medical teams, they also have a medical division. And they will discuss the treatment and diagnosis plan and to follow and track the treatment effect of the patients. That is to say that we need to have a very good synergy and stay united to curb and contain the epidemic. I believe all of these medical teams, they are coming from well-known hospitals from around the country. So we have the confidence to complete the task. That is to treat the patients in critical condition and to reduce the death rate. We are definitely confident about that. For China-Japan Friendship Hospital, just like Huashan Hospital, we are also stationed in the Tongji Hospital in the Zhongfa Xin town. We are taking the job to cure the critical patients. When we arrive, we also join the family of Tongji medical team. We are actually conducting our work under the same guideline. For the China-Japan Friendship Hospital, we are also responsible for one section, which comprises of 50 beds. So all of these 50 patients are in critical condition. And some of them are under severe and critical condition. After we arrive at the hospital, first of all, we try to understand the process and we are adapting ourselves to the new environment. We also designed a series of processes in the process of receiving the patient and transfer the patient. So that is to say, for every step, we have a very specific process. So first of all, we set up the process, and second, we formulate some policies. For example, how we take shift for the medical workers, and what is the on-duty shift, and also we have some guidelines to help our medical staff to protect themselves. I think all of these policies are very important for us because we are coping with the infectious disease. We have to make sure that we can protect our medical staff. We do not want any one of our medical staff to be infected. So when they're doing their work, they have to follow the standards and the procedures that's been set by ourselves. And for the patients, we will manage all of those patients collectively. We will further classify the 50 patients. For severe cases, we also have severe patients and the patients under critical condition. And we will make good use of the experts so that they can better treat those critical patients. And pretty soon, we will start to use ECMO to treat our patients. Hopefully, by doing all of that, we can make good use of our medical equipment and fulfill our goals. Thank you.
我是中央广播电视总台央广记者左爱福。我的这个问题呢是提给马新院长。据我们了解呢，上海华山医院医疗队布在多个医院。请您介绍一下
We know that the Huashan Hospital has dispatched different medical teams in different hospitals. Can you tell us more about your work and what measures that you have been taking to treat all of those patients under critical condition? For Huashan Hospital, we have sent 4 medical teams. The first one is in the Jingtan Hospital, 4 medical staff, and Wuhan No. 3 Hospital, also 4 members. And the third team located stationed in the makeshift hospital, 16 people. And for the last group, 215 medical workers, they are working in the Tongji Hospital in the CCM. So as for the medical resources, we are managing all of those resources collectively. And for the personnel management, it is quite independent, but sometimes we need individual experts to support. Among the 4 teams, I would want to highlight the third team and fourth team. The third team is the medical team that are stationed in the makeshift hospital, as the makeshift hospital is quite new to all of us. So for a large makeshift hospital, it has around 1,000 beds. So we need to work closely. At the beginning, we may have some challenges. For example, for Hongshan Stadium, the makeshift hospital, we have over 13 medical teams working there. So we have to work together to form the synergy. So all of us are actually under the guidance of the Wuhan University Hospital, so they will give us some guidance, and each one of the separate team will give full play to our knowledge and our capacity. As of now, the makeshift hospital is working quite well, and pretty soon we will see more patients being discharged from the makeshift hospital. And for the CCM, we are actually helping the Tongji Hospital Even though we have only like 30 beds in the CCM, but we invest a lot in treating some of those patients. So most of the patients need to use ECMO to survive, and in the Guanggu Hospital we have 17 national medical team. So for Huashan Hospital, we are responsible for one of the ICU. For the other ICUs, there maybe have like 50 beds, but for our ICU, we have around like 30 beds, but each one of them are in very dangerous situation. And so for each one of the patients, we will allocate like 2 to 3 doctors to pay full attention to all of those patients. So it also poses a great challenge to the doctors and the nurses. And also, I have brought the elites and the talents from the Department of the Infectious Disease of the Huashan Hospital. I believe by taking this opportunity, these people can learn from each other and can reduce the death rates for those patients. By working in the team, the most important thing is the cooperation. For example, how can we better cooperate with Tongji Hospital's doctors? But still, we have to follow the guidance of the local hospital. So even though there are 17 national medical teams that are working in the Tongji Hospital, but we have to form a synergy, because I understand each one of the medical team, they may have their own philosophy and their own way of treatment, but we have to form a standardized way. So we have to have a group leader so they can map out the procedures for us to treat the patients.
新冠肺炎的话，它作为一个新的疾病，大家都是普遍关注它的特效药。
As NCP is a new virus and a new disease, and many people pay attention to the medicine that could potentially cure the NCP. And some people are referring to some of the medical machines, for example, the respiratory machines and ECMO. So what are the roles that these medical supplies, these medical equipment play in curing the disease? Yes, indeed, we do not have a specific medicine to cure the NCP. For the ECMO and the respiratory machines, these two medical equipments play a key role in cure the patient. As we all know that this pneumonia has harmed the function of the lungs of the patients. If we have ECMO and the respiratory apparatus, it can help the patients to breathe. And ECMO can provide support to the patients. Can also inject oxygen inside of the body so that the lungs can be rested. With supporting medical treatment, if we can save some time to cure the lungs, I think it's very good for the treatment of the patient. The ECMO and the respiratory machines are very important to cure the patients who are under severe conditions or critical conditions. That's why all of these national medical teams, they are bringing these cutting-edge technologies and the machines to Wuhan. I believe all of these medical supplies can play a key role in cure the disease.
我觉得刚才这个马新副院长他这个讲的也非常好，也非常清楚。的确在
I think the Vice President Ma Xing has made a lot of points. As of now, we do not have any specific medicines to treat the NCP, so that's why we see these life-supporting equipment are very important for us to treat the patients. If we do not have this kind of equipment, so So the lives will be jeopardized for the patients. As I've just said, we have brought 4 respiratory machines for each. And also, when the patients are being transferred to other hospitals, we also have to use this kind of mobile respiratory apparatus to support the patients. And also, we bring in 3 ECMO to help the patients. I think all of these medical equipment are very important to treat the patients under critical condition. It will help us to reduce the death rate.
刚才那个周书记和马院长都讲得非常好。那么这点我再补充一下，除了我们这些新
So I just want to add a few points. In addition to all of those cutting-edge equipments, we also want to focus on the nutrition and some of the medicines to support our patients.
还有我们的整个这个代谢方面这个支撑都非常重要，甚至的话，我们对
And also we need to have some equipment and medicines to support the metabolism of the patient.
我们对心理各个方面呢，这些方面也都非常重要。
And also we have to provide some support in the psychological areas for the patient.
你好，中国日报记者提问。我们了解到大家都比较好奇，咱们援鄂医疗队医生护士一天的工作是怎么安排的？另外，
So many people are curious about the schedule for our medical workers, because for these people, they are wearing the protective suits for hours. They cannot have time to drink water or have meal. So, is that true? Can you tell us more about the situation of our medical workers? This is a good question. Actually, in the ward of the infectious disease and the CCM, it is quite different from the regular wards. As some of these patients, they have this kind of infectious disease. That's why our medical workers, they have to protect themselves. That's why they wear masks, they wear the protective suits and gloves, etc. So as these patients, they are needing the doctors. So that's why we have to work 24 hours. So for the nurses, we are having a 4 shift. For the doctors, 4 to 6 hours, we will make a shift. And for the doctors, they will work a little bit longer than the nurses, because we have to monitor closely the situation of the patients. For certain patients, if they're in extreme difficult situations, we have to they stay there over 8 hours. Just as our director of the medical team, on the first couple of days, they are actually staying in the ward for over 12 hours. So in order to ensure that our medical workers are being well protected, so these people cannot drink or eat or go to the toilet. So these people, they do not drink a lot of water before they enter into the ward. Maybe they will eat some eggs to help themselves to get some nutrition. And some of them even wear diapers, so they do not have to go to the toilet. And after they leave the ward, they will clean themselves. Yes, indeed. For our medical workers, they are faced with patients with infectious disease. So they are working really hard every day. So at the beginning, when we arrive in Wuhan, we prepare a big bag of diapers for our doctors and nurses. And for the nurses who are working in the makeshift hospitals, we will offer them the diapers because they have to stay in the hospital for over 6 hours. And the same situation in Tongji Hospital. So in the regular ward, actually the medical workers can leave the ward. However, this time around, the situation is quite unique because it takes a long time for them to put on and take out their protective suits. So that's why these people, they rather insist on their positions. And at this time, we also know we are running out of some of the medical resources. We just want to save as much as possible of the medical supplies. So you could see for some of the doctors and nurses, they're wearing the goggles and masks for such a long time, you can even see some of the marks on their face.
我们这几天我们也做了调查。 我们的医生护士也是给他们配了纸尿裤。
So in this couple of days, we have some investigation, and we also offer our medical workers with diapers.
问下来，没有一个人
And I also interview some of them whether they use the diapers or not. But they said most of them are not using diapers because when they are wearing the protective suits, it's very hot inside. It is not comfortable to wear the protective suits, so they would rather not wearing the diapers. So sometimes I myself wear the protective suits. Sometimes I chat with the patients. I understand it is not a good experience to wear the protective suits. But when you're wearing the protective suits, you cannot use your hands to scratch yourself because it's very dangerous. It may expose you to the environment. So that's why Mr. Zhou just said some people, if they're wearing the goggles and masks for a long time, there may be some marks on their face. So that is the actual situation. Due to the time limit, last question. From Legal Daily, we always talk about if Wuhan can win the battle and Hubei will win the battle, and if Wuhan win the battle and China will win the battle against the NCP. So, what is your comment? Mr. Han. People always say if Wuhan can win the battle, and then the Hubei can win the battle, so China will win the battle. Actually, this is a strategic guidance that has been delivered by the central government. I think this is quite reasonable because Wuhan is the epicenter of the outbreak. So if we can't continue to contain this virus inside of Wuhan so that the virus cannot be spread outside of Wuhan, if we can cut off all of those transmission sources, and if we can cure some of those patients under critical condition, by doing all of that, we can contain the epidemic, and we will contribute to the curb of the national outbreak. Mr. Zhou.
通过一组数字啊，我们每天都在关注的，也就是疫情的确诊人数。
Actually, each day we are tracking on a lot of figures. For example, the number of confirmed cases, suspected cases, and the cured cases. All of these figures are very important. As of now, we have around 45,000 confirmed cases. As for Wuhan, it is 196,000, and in the Hubei province, it's around 33,000. And for the death number, it is around 1,115. And for Hubei province, the death number is around 1,068, and in Wuhan, the death number is over 800. So we could see Wuhan takes out a big portion for all of those number of confirmed cases and the number of deaths. So that is to say that we have to do a good job in containing the virus in Wuhan, because if we can successfully contain the virus in Wuhan, it will also contribute to the Hubei province and to China at large. If we can reduce the number of deaths in Wuhan as well as Hubei, I think this is quite an encouraging message that will be sent to the nation. So I agree with this policy. If we can contain the situation in Wuhan, that we can contain Hubei, and then we will finally win the battle against the NCP in China. That is my understanding. I couldn't agree more with the comments from Mr. Zhou Jun and Han Ding. As we all know, Wuhan is the epicenter of the outbreak. We have to control the source of the infection. If we cannot contain the virus, and then the virus will be spreading out across the nation. If we want to win the battle, we have to focus on Wuhan. Then we can contain the situation in Hubei. So it is our top priority to contain the coronavirus in Wuhan. So let's all work together to win the battle of the NCP. I believe with all of those medical resources, we will be successful in the end. Thank you. Thank you all for the speakers and the reporters. That's the end of the press conference.